Talking Life, Health and Healing with Dr. Clive Campbell, Tuesdays from 9 a.m. until 9:30 a.m. only on Old Harbour Radio 1.
Well. Great day, great day, great day. Ladies and gentlemen and listeners, you're listening to Old Harbour Radio 1, the voice of the people. The name of this program is Talking Life, Health and Healing with Dr. Campbell. Today, we want to continue our powerful conversation as we look at the microbiome, especially the gut microbiome and the microbiome all over our body. And we want to continue to educate ourselves and empower ourselves in terms of the true makeup of the human frame, so we may more intelligently live a life that is consistent with the type of creatures that we are. So I thank you for tuning in. Now, kindly allow me to do the FDA disclaimer. It says, this content is strictly the opinion of Dr. Campbell and is for informational and educational purposes only. It is not intended to provide medical advice or to take the place of medical advice or treatment from a personal physician. All listeners of this content are advised to consult their doctors or qualified health professionals regarding specific health questions, especially those who are taking prescription or over-the-counter medication. Ladies and gentlemen, we have been pouring a lot of effort and time copiously to be looking at our body, because we are now understanding from information coming through to us that our body that we think that we have and the way we have been living is not the way we are to live, because we are not the creature we think that we are. Now look at that. That's interesting. So what we realize is that you do not only live in your environment lives inside of you. Did you know that? Did you realize it? Have you reasoned it out? Because some of us are so smart. We know that some of what they are teaching us is not altogether full 100. So we are on this quest to better understand ourselves, or else we're going to damage ourselves. Now, we just do a short synopsis of some of the things that we might have said so far. So for those who are joining us today, might more follow the conversation and benefit more from us. Because one of the important thoughts we have made is that what makes us human ain't only human. We have entities with us that are participating in our well-being, as well as our own organs, our brain, our heart, our lung, our liver. We have to understand that there are entities that are cooperating with us as human. So we are saying that God is allowing and guiding man to discover himself. This is not somebody somewhere that say, boy, I'm going to tell them God is forcing the hand so that we may not continue to live in the dark and hurt ourselves. So God wants us to know just how wonderfully and fearfully and even carefully he has made us. So we are continuing to look at that. We also looked at that we are more and we have more than we previously thought. You are not just human entity, not just human cells alone. You are a walking, talking, breathing, super intelligent ecosystem. This is the greatest surprise. Many of us have lived thinking that we are so sterile. What a surprise. The unexpected discovery, the uncomfortable discovery. But there is irrefutable evidence, because with advancement in technology, especially the microscopes, we are now able to see things that the naked eyes alone could not see. And the undeniable research that keeps going on so that we may understand the nature of our lives that we really are. So there's evidence that demands a verdict, and we are very happy to be leading the way in having us to think about it so that we might function more intelligently. We use the analogy like much like a woman who has discovered that she's pregnant. When she discovered that she's living for more than just herself, she discovered that she's eating for two, maybe three or more. Look at that. So she can't just do everything the way that she used to do it. She is making adjustments and alterations to her very lifestyle. She wants to live healthier. The doctors, realizing that she's pregnant, have to adjust certain types of medications that she may have been on or that are thinking of giving her because of different things that may happen. She is watching what she drinks. She might even go as far as to stop smoking and things of that nature. You know, she becomes more conscious. She becomes more deliberate and intentional about everything that she does. You know, this is just the reality of what is happening. And so every woman must come to realize and understand that they are pregnant. And not only women, but even men too, because we are pregnant with, so to speak, with these microbes, and we cannot just brush it aside. So this is something that is very delicate, something that is unique. We are pregnant with something that is intelligent, something that is indispensable, extraordinary, and just such an indefatigable part of the human makeup of the human story. So your body is playing host to diplomatic representatives, so to speak, of your very environment in which you live. We have more than 100 trillion microscopic organisms. Wow. And we have to be careful how we live our lives going forward. The microbiome, we are reminding ourselves, is not your enemy. The microbiome is not to be considered something like a parasite. It is not. Your microbiome is not to be seen as a threat. Your microbiome is not to be made persona non grata. We want to be careful that we remind ourselves about these things. And the microbiome is not to be poisoned. We mustn't try to damage it or try to destroy it. The microbiome is a necessary part of the chemistry of your very life. It's a necessary part. Some persons believe that it's a bother and a burden, but we are understanding now, based upon the things that they do, that this microbiome is a critical part of the human frame. So, in a sense, the microbiome is like the wind beneath our wings, the wind beneath our wings. They make us go places. They empower us, or they carry us to places and in our lives. These what is to be considered our human pals, not enemies, our pals. We can't live without them. The microbiome fights for you. It doesn't fight against you. The microbiome makes you look good, feel good, and even to live good. It makes you happy. The microbiome makes you healthy. Wow. Ladies and gentlemen, just in case you have just tuned in, you are listening to Old Harbour Radio 1, the voice of the people. The name of the program is Talking Life, Health and Healing with Dr. Campbell. And today we continue to look at our human pals, because our story is not complete in terms of our textbooks are written. They have missed out and left out critical, important components of human health that we need to come up to scratch with, so to speak. And we are now learning because we have access to so much information that in the past we did not have. So we are saying something for our microbes, because no one can survive without their microbiome. No one at all can survive without their microbiome. We have a microbiome, or we are part of a microbiome. Everything living on this planet has to be part of a microbiome or contain their own microbiome. So we want to establish that your health is your greatest wealth. Your health is your greatest wealth. And God wants you to know. And God wants you to be what? In good health. No one can be in good health without their microbiome. So that is why we like to remind ourselves of the quotation that Thomas Edison shared with us. That this 100 years ago, he said this, the doctor of the future will give no medication, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. So we have been asking for the good doctor to come forward. And this is the type of doctor that we need today. The doctors that will not wait until we are sick. The doctors that will not even help us to get sick. Because I should say that sometimes our doctors, they do not know how to teach us how to prevent disease. They don't know how to teach us how to eat, to beat disease. So we wait until we get sick. Then we march our way to the clinic, we march our way to the hospital, to the doctor, we march our way to the surgery, because we are not told how to avoid sickness. We are even assisted in becoming sick in terms of the food that we consume, in terms of the lifestyle that we live, in terms of the fact that the water is not clean and it's not good. The air is polluted and contaminated. And they are with the personal care items that they allow us to use on our skin, to use in our hair, to use to bathe, and to use to smell good and such alike. Those things contain some chemicals, some parabens, some forever chemicals, and other such things that it frightens you that these things are allowed, man's inhumanity to man. The underarm deodorant that causes issues inside of our tissues. So the doctor of the future, we need help, man. Somebody we depend on, because the system has invited us to trust them and to just blindly do what they say. If they say jump, always says how high, But now we are realizing that we may be misguided, maybe misinformed, because we are misinterpreted for a body that we are living in, that we are now learning to be different. So he's hoping and praying that this good doctor will help us not to rely on medication, not to pop a pill for every ill when we get sick, not to rely on medication, not to rely on surgeries, ladies and gentlemen, but will interested in how the human body is really made up, will instruct us, will inform us, will teach us, And today we have to be using these fancy words and fancy terms, because the things that they should have taught us from we were smaller, younger, babies, children, that we were not told these things. And now we have to be learning and trying to wrap our heads around what is our new reality. That we are living in a body that is as bacterial as we are humans. Ladies and gentlemen, a body with a lot of microbes, a body that comes with a microbiome. This is changing our story. Man, look at that. 6 pounds. 6 pounds of microscopic organisms that we have. And we become sick in proportion to how we damage this microbiome. A microbial zoo comprising of bacteria, virus, fungi, protozoa, archaea, and parasites. We do not have our bodies to ourselves. We have travelers with us on our journey, and we have to realize that We have these guys that are with us and they are playing a critical, important role in our existence and survival. So we have these travelers and we should not try to get rid of them. How much of us are them and how much of them are us? Look at that. So the human cells, we have some say 10 trillion, some say 30 trillion human cells. But in terms of microbial cells, 100 trillion microbial cells. Look at that. And this is not something that we make up, because this is something that we studied from 1990 to 2001, 10, 11 years of study. And we had the top 20 universities in what is called the Human Genome Project participating. 1,000 top scientists across the world participated. And for us to understand that this is the makeup that we have. This is not a small group of people somewhere trying to suggest something and a theory. No, this is a reality. This is what the best of our science is telling us. And Professor Julian Davies remind us in 2001 as he wrote to the Science magazine that be warned that you cannot consider human health and not to include bacteria, not to include the microbiome, because there are more than 1,000 species of bacteria living on us and inside of us. And as a result of that understanding, after they realized that at the conclusion of this Human Genome Project in 2001, when they did not find that the answer to what they were looking for, because it's not a gene that they discovered that causes cancer, or a gene that causes high blood pressure or Alzheimer's. They realized that something is missing, and that they listened to Professor Julian Davies. And in 2006, they started the Human Microbiome Project. This was a very critical part in discovering who we are. And from this Human Microbiome Project, we realized that we have 23,000 human genes, yes, but guess what? We have more than 2 million microbial genes. Wow. 2 million or more microbial genes. That is why we say what makes us human ain't only human. So we must understand that scientists would want to study the human genes, yes, but why now are they studying the bacterial genes? The answers are with the microbes. The microbes have it. The answers that they were expecting to get from the Human Genome Project, they did not get it, and they had to find it in the Human Microbiome Project. Ladies and gentlemen, this is major news. This is massive. This is where the world is heading, and this is where we have to wrap our heads, that God would have us to know our true identity. What makes us function as human is not human. Dr. Stephen Gunge said that most humans are not happy to have bacteria so much up in our business, but we have to get used to it. Dr. Francisco Delgado says bacteria are an extension of the functions of the human body, and they help us to stay healthy. Now look at that. Look at that. We are here thinking that bacteria makes us sick. The discovery is that bacteria are an extension of the functions of the human body, and bacteria help us to be healthy. Wow, what a shift. What an adjustment has to take place. And the great Dr. Daniel Vitalis is understood to be the guru as it relates to the gastrointestinal tract and understanding that microscopic organisms. He said our understanding of the gut microbiome will overturn everything we think we know about health, about medicine, and about science. Look at that. It will overturn it. The things we are teaching. And that is why Professor Tim Spector, King's College, United Kingdom, said the textbooks of this world must be torn up. They no longer represent the truth. That old science and old narrative has to be changed. We cannot continue to teach our medical students these things, because they are going to further misunderstand the care of the human body that they care for. I tell you, ladies and gentlemen, we have more to talk about. But ladies and gentlemen, in case you have just tuned in, you are listening to Old Harbour Radio 1, the voice of the people. The name of the program is Talking Life, Health and Healing with Dr. Campbell. Today we continue to look at the microbiome, our human pals, our friends, and we are using the evidence of science, some of the brighter minds and the scientists that have been looking at the microbiome for decades. And just to inject here, that the term microbiome was introduced to the fraternity by a Joshua Liedenberg in 2001. And most persons tend to refer to the umbrella term microbiome to represent the bacteria, virus, fungi, protozoa, archaea, parasites. And so we continue to remind ourselves of these terms. So we are more and have more than we are told. And just as how at a baby shower, sometimes they reveal the gender, the sex of the child, that we are now having a big reveal. Humans are having a big reveal, so that you come with a microbiome. You grow a microbiome in the first 1,000 days of your existence. If all you see is all that you see, then you do not see all there is to be seen, because you cannot see microbes, and therefore doctors not seeing the microbes did not understand that they are there. They are too small for you to see with the naked eyes. Because you cannot see it, it doesn't mean that they are not there. So here it is, that we are like eagles being forced to live as chicken, not understanding the true worth and value of the human body. We are like prince living as paupers, because we are impoverished if we do not understand the role that microbes play, and we try to get ourselves rid of these microbes. That's a big mistake. So the question is asked, Dr. Campbell, where did we get this microbiome from? You get it from your mother. From your mother. As you were scraping through the birth canal. That's why it's important, the way that you are born. We're going to say something more about it now. As we scrape through the birth canal, we were getting introduced to our microbiome, because something miraculously happened in the 3rd trimester of pregnancy. Did you know that there's a shifting in the makeup of the microbiome in the vagina? What do you mean by that? There's a shift? Yes, because the bacteria in the vagina is always different from the bacteria in the gut. But in the 3rd trimester of pregnancy, what is happening is that the vagina begin to reflect the same types of bacteria that lives in the gut. Only God alone could do that. Because the child needs to get a baptism, so to speak, of these microbes and get introduced to these microbes. And here it is, that there's a shifting, that the same makeup of microbes found inside your GI tract, your gut in particular, your colon, begin to be reflected in the vagina, so that as a child is being born, it is introduced to these microbes. And that is where we were introduced to the majority, because we may be exposed to some bacteria while the child is being grown in the womb. But it's a small amount. But the lion's share is what you get as you scrape through the birth canal, that is now reflecting the same type of microbes inside of the gut. That is why now the cesarean section may be so dangerous, because when a child gets a C-section, is born by a C-section, then they do not get the full complement of bacteria that they have to get passing through the birth canal normally. So the tend to attract bacteria in the operating theater they are born in. The bacteria that is on the garment of the attending physician or nurses, or as the child lays on the mother to get breast milk, then the Firmicutes bacteria may be the dominant type of bacteria they get there, you know. So what might be helpful is that the human breast milk contains 600 microbial species, so that might jumpstart the child's immune system. But guess what? Many children are not fed breast milk for any extended period of time. The mother is trying to get herself to go back to work, or something may happen. The mother being operated on to remove the child, maybe in a different environment from the child because she's recovering and she's getting medication. And that child might be getting some serious medication from the breast milk if they are not very careful. So these are considerations that are to be made, that is very critical, the way that a child is born. And we are championing the cause for people to become aware of that, so that we might be able to advise more mothers that they may want to not choose the route of doing a C-section that is seem to be more fashionable than medical causes, so that they might bear in mind the health and the life of the child over personal situations. So we are having this conversation. What some people do in some jurisdiction when a child is born C-section is that before the C-section is performed, they put a gauze in the vagina of the mother to mop up any vaginal fluid, and they will keep it. And when the child is born, they smother it over the child's face, over the child's chest, upper arm, as much of the child's body. And what is finding so interesting is that those children, even though C-section, will tend to live a more normal life than the children that are born C-section and don't benefit from this type of practice that I just described. They become candidates for obesity. Those children who are born C-section and not being smothered with the vaginal fluid, they not only tend to become obese, they tend to become autistic. I'm not saying that all autistic children are a result of this. They tend to have allergies, food sensitivities, and maybe later on in life, maybe candidates for autoimmune diseases like lupus, rheumatoid arthritis, type 2 diabetes, and Hashimoto's thyroiditis and things of that nature. So these bacteria, ladies and gentlemen, they perform a very critical role in our story. We must do everything to prevent these bacteria from being damaged. Wow, the time. We have to continue next week because there is much more to be told in our untold story. So, ladies and gentlemen, I just want to thank you for tuning in and listening to Old Harbour Radio 1, the voice of the people, and this program, Talking Life, Health and Healing with Dr. Campbell. Be invited to return next week as the conversation continues, us looking at ourselves and understanding ourselves better so we live better. You may call me 876-452-5075. Walk good. See you next week.